Next up is Jeff Clavier, who has created SoftTech VC, as you know, very well-known fund now and established in Silicon Valley. And Jeff Clavier is a curator this year of the Future of Healthcare session. Very exciting that he's been working on with Daniel Kraft, but I'd let Jeff explain what his session is. Jeff?
Merci Loïc. Bonjour Paris et le LeWeb. It's a pleasure to be back and to host for you the session on reinvention of healthcare. Can we cue my slides, please? So, why did I choose that topic to be in front of you today? As we'll discuss over the next hour and a half, digital health is finally happening. This is something that we've been waiting for, wishing for a number of years, and it's finally there. As Fred Wilson and Loïc mentioned yesterday in their intro discussion, it is a really massive opportunity. We have this technical term, ginormous, gigantic, enormous. And just to put the numbers behind this, as far as the US healthcare spending is concerned, you can see that in 2015, next year, it will top 4 trillions. That's 4,000 billions, 4 millions of millions. It's big. Why is it finally happening now? It's really sort of a perfect storm effect of getting together a number of IT platforms that we know have been leveraged in a number of other industries, so social, mobile, cloud, big data, sensors, and so on and so forth, being applied to healthcare. In the US, the Affordable Care Act, which we call Obamacare, is basically forcing the adoption of those new technologies because they need to, basically we have 10 more million patients that get insurance in the US, and that has created issues for doctors, hospitals, insurance, and therefore they need to bring all these new technology platforms to enhance the productivity, control the spending, and improve the outcomes for patients. There's also the fact that we have baby boomers that are aging and getting into retirement and unfortunately starting to face healthcare issues more and more, and millennials, their children, who want on-demand modern solutions, to help their parents get care. The challenge is we're still in a very heavy regulatory environment, mostly because of the FDA, and that will sort of create friction for new platforms to come to market. So there's going to be a lot of interest in terms of innovating and investing in digital health. There are a lot of opportunities, but there's also a ton of noise. Just to give you a sense, this is a market map of a small portion of the solutions which are out there in the market. As you can see, actually you can't see because the logos are too small. It's actually it's a very busy slide because there's already a ton of companies which have started to market the solutions in healthcare. The good news is that VCs have been paying attention more over the last year and a half than ever before. And globally, we have seen close to $3 billion in VC investments in the space. That's 85% in the US, 15% abroad. But if you look at sort of the actual amounts invested in early-stage companies, that means there's a lot of innovation being funded. As far as we're concerned, we've actually been pretty busy over the last 12, 18 months in the space. So 6 years ago, I was a seed investor in Fitbit, which is now the market leader in the fitness tracker space, representing 70% of the market. And more recently, we've done a Yelp for doctors and a few new companies like Hello that you will hear about today. So what do we have for you in the next hour and a half? First and foremost, my friend Daniel Kraft will give us a perspective on the future of medicine. We'll then have 4 presentations from very different startups in the healthcare ecosystem. And finally, we'll have a panel discussion. A word on Daniel. So he's a Stanford and Harvard trained scientist. He's been doing research for the last 20 years. He's the chair of the medicine track for the Singularity University, and most importantly, is the producer of the Exponential Medicine Conference, which happened 3 weeks ago, where he spent a week with the summities in medicine to talk about the future of the space. And for the cool factor, he's actually a pilot and a flight surgeon for F-15 and F-16 fighter squadrons. So I'd like you to join me to welcome Daniel Kraft to the web stage. Daniel. The floor is yours.
Bonjour. Thank you, Jeff. It's a real honor to be here in France at LeWeb. And in this section, we're going to take a quick deep dive into some of the implications for many of the amazing technologies that you're developing and are coming to the world, and how they're going to impact the future of health and medicine, how we can reinvent health and medicine across the spectrum. Because it's not just about staying healthy, it's also about how we can do a better job with diagnostics and therapeutics and discovery. So before we think about the future, let's look about where we are today. We actually aren't in a healthcare system. We're more in a sick care system. We actually value and pay for only when folks tend to get ill. And that's where we spend over 80% of our healthcare dollar. But we have the opportunity to shift that equation from our very reactive system, which waits for the heart attack, the stroke, the lump to be discovered, and our very sort of intermittent system, where you get an occasional blood pressure check, an occasional EKG in the clinic. The data you get at home is scattered and occasionally gets back to your healthcare provider, and shift that to a much more proactive and continuous system. Because our data today is scattered between paper records, electronic records that don't speak to each other. Our feedback loops between our home, our family, our care team are often broken, that important feedback loop of data. And our access in many parts of the world, whether it's rural America or rural parts of India or beyond, to actual clinicians is very limited. There's actually a large primary care physician shortage in most parts of the world. Educating ourselves as consumers, our physicians and nurses, is a very slow and laborious process, because many ways the healthcare system today is designed like it's been designed for thousands of years in old silos and old definitions, sometimes based on body parts and specialties. And the way we think about healthcare is we wait those 37 minutes on average for that 12-minute visit with your physician. But it's time to rethink and reimagine healthcare and to shift the incentives from the sick care side of the equation to the health side of the equation. And technology and the web can play a critical role in moving this equation to the right. And also shifting who owns your health. It's you, the consumer, the patient, no longer the physician, sort of the God who speaks down to you and tells you what to do. The new drug is really you, the empowered patient and consumer, where you own your own health. You're the CEO of your own health. So technology is certainly moving very, very quickly. You know, the scene of the Pope being inaugurated in 2005 compared to 2013 just exemplifies the power of Moore's Law, you know, in our pockets. The smartphones in our pockets riding Moore's Law and exponential technologies have about 1 billion times the price and speed and performance of the best supercomputers at MIT in the 70s. And these are really disruptive, not just as platforms for communication, but becoming healthcare platforms. You know, think about it. The iMac of 2000 now fits on the iPhone and soon will fit on the iWatch. And that sort of evolution is transforming connected digital and the future of healthcare, not just through Moore's Law on our mobile, but big social data, sensors, Internet of Things, genomics, all converging. And it's at their convergent point where the point and the opportunity for reinvention really occurs. So as you're thinking about whatever skill and technology you have, think how you might layer them together. Just like, you know, the phones have evolved. And remember, that was really cool. He's on the beach on a phone. That was pretty amazing. Now these smartphones are becoming healthcare platforms, integrating with diagnostics and feedback loops and artificial intelligence. And if you imagine, you know, today we have the smartphone version, let's say iPhone 6, what will the iPhone 10 look like, or 11? Lots of ways to think forward about how these will be leveraged into the future of medicine. And dematerialize old school technologies. You don't go and buy a GPS device now. You dematerialize it. You download it, and you have that available. That kind of sensibility is coming to healthcare, particularly with lower-cost tablets, for example. In India, where I was a month ago, there are $35 tablets being sold. That can democratize education, but also healthcare. When in a rural village, a nurse can have a tablet like this, or a student can learn and educate. Tremendous applications as they move forward. So as we reimagine healthcare, we could just get a taste by reimagining what's happened in the last decade even. We've reimagined, reinvented how we pay for things, how we read. Amazon has self-disrupted themselves, how they read. We don't go to buy or rent videotapes anymore. They come streaming to us through the web. here at LeWeb, where Uber was conceived, think about it, a 4-year-old company worth now $40 billion didn't invent the smartphone, mobile, maps, GPS, online payments. They bundled it together in an elegant way and has made travel and other elements delightful and engaging. And the new generation, the millennials, want that same sensibility in their healthcare. So I actually tweeted out a few months ago, who's building the Uber for healthcare? Like 3 companies came back, and by the way, there's regulatory issues. Sometimes you have great technology, but the policy uses don't mesh. But I tweeted out, who's building the Uber for healthcare? And like 3 companies came back and said, we're building it. You press a button on the app, and a doctor comes to your home within 3 hours to see you. Not sure what kind of doctor, but you get some sort of doctor. And remember, you can rate them, and they can rate you. So that sensibility is coming. And even Uber, a month or so ago, did a trial, Uber Health, where you'd press a button on the app, and a nurse would come with a vaccine to give you a flu shot. So those sorts of sensibilities are coming and are helping rethink and reinvent and disrupt elements of health and medicine, just like many other fields have shifted dramatically in the last decade. So I've been fortunate as a physician to chair the medicine track at Singularity University since it started about 6 years ago. And one of the things we do is bring smart folks together to look at fast-moving technologies and how they can address big, grand challenges in the world: poverty, education, healthcare. In fact, about half of our projects in our 10-week summer programs have been related to health and biomedicine. And because so many folks come to Singularity University who are not traditional medical folks, I put together a program now we call Exponential Medicine, where we blend physicians, nurses, IT folks, web, data, investors, and we think about where everything from robotics to drones can take healthcare. So it's a really interesting time for all of us to play a role in its reinvention. So our program's grown from 100 people to about 600 this year. Come visit us next year at exponentialmedicine.com. How about starting with health and prevention? That's the most important element. What can you do for your health? Well, we know that just 30 minutes of exercise a day, something pretty easy to track, is one of the best drugs out there. Losing just a little bit of weight over time has dramatic impacts in depression, cancer risks, and beyond. And we have a whole new slew of tools and technologies to measure this. You've all heard about the quantified self. I'm not sure how many of you are wearing a Fitbit, for example. I'm wearing like 6 different versions today, right? So these started as pretty simple technologies to track your steps and your sleep, but they're evolving, and they're converging with their other devices, everything from tracking your pills to your weight to your sleep. Speaking of sleep, not hard to get here at LeWeb, one of the most incredibly important elements to our overall health and longevity, now we can measure it and have insights and hopefully optimize that using some of these connected tools. And these connected tools are disappearing from our wrists. These are sort of sensors 1.0. The next versions are moving into our wrists and into our phones, smartphones that are modular, that can include glucose sensors, or others that will detect our blood pressure and all of our mental health issues as well. Into our clothes, into our cars. The Internet of Things is coming to the Internet of the body. It's even coming to our younger patients. This used to be science fiction from the back cover of Wired magazine, the connected diaper. Not science fiction anymore. Last year, Huggies came out with Tweet Pee. You can kind of figure out what that does. There's also other data as well, which you might want to acquire. So interesting new ways to have healthcare out of the hospital into the home, and even now, connected onesies. This is my son, Leo, a few months ago, doing his part for science, wearing his connected onesie. He's a healthy guy. I don't necessarily need that data to tell me he's keeping me up at night. But if I had sent home a child from the hospital early, we might have these abilities to connect and measure important data. And these sensors are becoming disposable, conformal electronics. They're disappearing into our clothes, into our contact lenses. Google, of all people, has developed a connected contact lens that measures glucose, and they've partnered with Big Pharma, with Novartis, to bring that to the market. So incredible new ways of going from wearables to insidables and other realms of connecting data. Now, it's a big data era. We're not just interested in data overload. That's hard. We want that data to make something, make it useful, actionable information. I like to call that predictalytics. How do we pull all that information so it's useful to you? And I think the best analogy for that is the modern car. The modern car now has 300 or 400 sensors. You don't care about any one sensor. You care about when your own check engine light goes on. So what if we could use the Internet of Things, your devices, your home, and beyond to give you a clue when it's time to plug in before you blow up your engine and be proactive? So this idea of an OnStar for the body or a GPS for your health, I think, is emerging for all this. And just like there's Google Now, which will remind you to go to work, but depending on traffic, I think next versions of these will integrate all your data and say, hey, time to go for a run, or time to check into the gym, or time to take your medications. Now, we know behavior change is hard. So what if we could leverage other technologies like augmented reality? What if you could see the you of tomorrow when you looked in the mirror? You of tomorrow, if you're kind of losing some weight, if you're really working out. If you're doing your P90X, you of tomorrow. Or what if you keep having 2 donuts for breakfast, you of tomorrow, right? That can really impact our brain. You can see yourself into the future, and there's apps you could download now. Here's me now, and here's me 1,000 donuts later. You know, I think a little bit differently about what I might eat in the morning. Or if I'm counseling a young woman about her smoking, and I can show what her skin is going to look like, that might change her perspectives. So there's new tools, particularly here in Europe, where many people are still smoking, to see yourself and the effects of smoking. That might change your brain wiring a bit to change all those important behaviors that downstream will cost your life or a lot of money. Now, there's tools that are available today. What happens if you spend time on Facebook can be scary as well, right? So tools like Oculus Rift, these new low-cost augmented reality worlds, which are even coming to cardboard-based versions, have had a tremendous ability to help rewire our brains from treating PTSD to focus and beyond. We'll see these things be incredibly useful. How about our personal genetics? Another way to help improve our health is to understand our risk factors. And today, the price of sequencing a genome has dropped at twice the rate of Moore's Law, from millions of dollars a few years ago to about $1,000 today. And in a couple of years, it'll be a $100 genome. That information can be incredibly useful to help predict your health outcomes, to tune what medications and doses you have. You can spit in a tube in the mail and drop it for €100 today and have a tremendous amount of information, not your full genome in most cases, but a lot of these omics are coming, not just genomics, but proteomics, the blood data, hundreds of thousands of biomarkers, environmental data. Your mobile phones have known where you've lived. That can be important in accessing your health. The microbiome, it turns out we have more than 10 times more bacterial cells living in our body than human cells. We're learning that the microbiome is incredibly important in obesity and inflammatory bowel disease. You'll hear later from Jessica Richmond from uBiome. We can now sequence and understand our own microbiome, and we're even using what's not a sexy term, but called fecal transplants to treat patients with very bad GI infections. So new ways to understand our omics and apply personalized therapies are coming. Now, assuming we're healthy, we might also want to optimize our health. There's new ways to do that with old East meets West traditions, mindfulness, meditation, yoga, incredibly proactive and preventative. In fact, we're now hacking the brains of experienced meditators so we can learn what their brains are when they meditate. And you, too, can use these forms of brain-computer interfaces. They're now commercially available on the market to the point where you can wear a headset. It can help you focus. This has been used to take kids who have attention deficit disorder and get them off of Ritalin. So new ways of looking at your brain. Ariel Garten was here, or yesterday, actually, Adam Gazzaley was here from UCSF, looking at the ability of using headsets and brain-computer interface and gaming to dramatically improve our cognitive functions, or those with deficits to improve their brains. And Ariel Garten was here a few years ago with the amazing Interaxon Muse. Is now a consumer headset that you can wear, in this case, to look at your own brain and how calm it is. Here's my brain, actually. You can see that I'm calm for 5 whole minutes. Okay. So incredible ways that we may prescribe headsets, meditation, and other elements to optimize our brains in the future. More advanced brain-computer interfaces can take the quadriplegic, someone who can't move from a spinal cord injury, and now with a small chip on her brain, she can now control a robotic limb. That's a game changer, both psychologically and otherwise, for some of these very disabled patients. And the next versions of these devices don't have cords. They're Bluetooth-enabled and will enable this disabled in very incredible ways. How about the future of diagnostics? If we pick things up early, that's incredibly important. This is the original stethoscope. Here's the more modern stethoscope. But today's stethoscope is digital. It's connected. It has an app for that. And these new stethoscopes can do a better job than I can as a trained physician at prescribing or describing what is that heart sound. Is it an atrial regurg? Is it a mitral stenosis? And this can de-skill important diagnostics. A nurse in a rural village in India can use this sort of application to be as powerfully diagnostic as an experienced cardiologist here in Paris, for example. So we have a whole new set of digital doctor tool bags that are democratizing our ability to collect data, whether it's something you connect to your smartphone to look in your ear, to do an ear exam on your children, or a whole variety now of ways to shrink what used to be difficult diagnostic problems, and there's been challenges now. This is an XPRIZE challenge to replace old diagnostic devices with small ones, like the iNetra device, fits on a smartphone, and allows you to do basic eye diagnostics. Their first market's actually in India, where there's very few optometrists or ophthalmologists. There's now a whole set of technologies, for example, the AliveCore EKG case. I just simply hold the case, and I can do a live EKG. And that's very powerful for screening patients. If you're an emergency room doctor, if someone drops down at a party, I can pick up their EKG. It's a great party trick. So really interesting ways to bring expensive diagnostics in the future into our pockets. And that's available now where you can actually press a button and have that EKG analyzed in real time through the web. So the blending of diagnostics as we move into the world is powerful. The next level is these wearable patches. I have a patch here from a company called Vital Connect. I'm wearing it underneath my shirt, and it's live streaming my EKG through the cloud. You can see my heart rate, my stress level, my posture, if I move around. If I fall down and I don't get back up, it could call my mom or call emergency services. And this is a lot of information streaming at us. The challenge for us as patients and as physicians is to start making sense of this as we go downstream. And if I do find a medical problem in my heart, instead of doing a catheter, I can do a 30-second CT scan, send that data to the cloud, have that now analyzed in the computer cloud, and determine, is my blood vessel narrowed or not? How narrow is it? Might I need a bypass? Or maybe I need a stent. What type of stent? Maybe I'll 3D print the stent to match my own anatomy. Or a cardiac MRI, this is done from a French entrepreneur out of Stanford, a 30-second MRI can now be reconstructed in the cloud and give you all the structures of the chest and all the functions of the heart that you get in an echocardiogram, and will be disrupting our friends in the cardiology world. We're taking military lessons of how we scan the ground and look for missiles to now look at skin lesions and say, how have they changed? Is that a melanoma or is that a mole? Blending military intelligence with healthcare intelligence. And speaking of intelligence, our brains haven't had an upgrade in thousands of years. We need new ways to augment our brains, not just artificial intelligence, but what I like to call intelligence augmentation to help the next generation of physicians and nurses and patients understand their information, put it in context. IBM Watson now is connecting through apps to mobile phones. It's going to be very powerful when you can access and put it together. In terms of putting it together, there are now incentive prizes. I've been involved with the X Prize for several years. We've designed a medical X Prize to make a medical tricorder inspired by Star Trek, to the point where you can, at home as a consumer, have a home-based device like this one from Scanadu. When you hold it to your forehead, it picks up your heart rate, your temperature, your oxygen saturation, your blood pressure, understands that, stores that, communicates that to your clinical team, gives you a baseline and understanding of what to do. And it's not just vital sign data, it's also lab data. Labs on a chip are coming, whether it's as simple as a urine dipstick, so you dip it in the urine, you take a picture with your app, and you now have your analysis done immediately. Or it might be flu season, so you spit in the tube and have your saliva analyzed. You have bird flu or avian flu, or maybe if it's Ebola season, this could be a useful way of detecting elements. And in fact, Harvard's Wyss Institute just published a way to have a saliva-based test for detecting Ebola. So incredibly important realms. And this comes together now in this idea of a digital checkup from anywhere. We're able now to do our vital signs, our lab reports, and connects us to our therapeutics of the future, which are increasingly going to be through apps. I might prescribe you an app for your meditation, for your surgery or beyond, or for your pre-op care, your post-op care. There are now apps that have been approved for managing diabetics, integrating their insulin, their activity. These are now being paid for and are FDA approved. We'll hear from Sean Duffy later in this session about prescribing an app for behavior change to turn folks who are pre-diabetics around. And these are showing impact. At Mayo Clinic, now prescribing an app to heart failure patients is preventing almost 40% of them from bouncing back in the hospital. So as we enter this era of connected health, digital health, telemedicine, we're going to be talking to our clinicians through our smartphones. We'll be prescribing or subscribing to visits through our smartphones. I can replace, instead of seeing a dermatologist, take a picture of the lesion, and as I did here with myself, had a lump on my neck, downloaded the app, had the diagnosis made, then went and had a plastic surgeon take it out in Palo Alto. 2 apps and 1 visit is really expanding the way we access care in smarter, more effective, and low-cost ways. Telemedicine is also blending with telerobotics. There's new ways to visit your healthcare provider or for them to visit you. Or you can go into a health pod or visit mobile clinics in India and Africa. Tremendous ways of bringing first-world medicine anywhere. And we're augmenting the clinician in these realms. I mean, Google Glasses had a lot of flack, but one of its best use cases is for the surgeon, for example, to see what's happening in context, or for the nurse, or for the patient to be wearing these and be aware of their healthcare environment. So a lot is happening in that as we move forward. I'm trained as an oncologist, a lot of opportunity to improve therapy in that realm as well. Robotics is moving quickly from the operating room to replacing anesthesiologists to enabling the disabled to walk. Wearable exoskeletons. This woman is disabled. The actual exoskeleton is 3D printed, parts of it to match her own anatomy. Speaking of 3D printing, that's also coming into healthcare, whether it's making a prosthetic for a child who's growing, matching your orthopedic injury to treat a fracture. You could now use a low-cost Microsoft Connect to print yourself. Here's Mini-Me. I carry him in my pocket, which is kind of cute in this setting, but what if you had a patient missing part of their face and you could reconstruct that with a prosthetic? Or use it to do better surgery and take a very difficult case and solve that for an individual. And later, we'll blend 3D printing with stem cell biology and beyond to bring it together. All this has global impact. We can leverage mobile now in places like Africa to bring those access to care or to prescribe Ebola, or bring new electronic medical records to those who don't have it. We're seeing drones play a role in delivering drugs and vaccines, and this has been piloted out of Singularity University. Tremendous opportunities there to take fast-moving technologies and apply them in new and surprising ways. And even there's a company in San Francisco that's claiming to bring drugs to you in the mission by drone. Not sure what kind of drugs, but they're going to bring something. How about discovery? We can use these new tools to prescribe a clinical trial that might measure your shaking if you're a Parkinson's patient. And these are even being used to crowdsource understanding sleep. This is the jawbone up and how are folks sleeping across the country. We're crowdsourcing cases with companies like CrowdMed to make difficult diagnoses. And as this world moves forward, we can take lessons from aviation. I've been a pilot for years. We can take lessons from maps and using this idea, like when we drive with Google Maps. Today, we're crowdsourcing information, and we're getting information back about where's the traffic and how does that come together to help us. We can do that same implication in healthcare and become not just organ donors, but also data donors. And in that line, as we can start to leverage and understand our social networks, we can pull that together. I'm just about to launch and co-founded a company called Nomad, where we're bringing together, for example, if you're in Palo Alto and you're visiting, you can see what's happening. The dish might be a good place to go for a hike. You can discover from folks around you what's healthy, what's a great activity. You can share your learnings. What's the great restaurant in Palo Alto you might go to that might be helpful for your diet, whether it's gluten-free or just trying to lose weight. You can search for certain elements that might be relevant to you, whether that's diabetes or food diaries. You could follow me, for example, and look at my runs around Palo Alto from the startup office, or how I did with Runkeeper and integrating data. So part of the future of healthcare is social and bringing it together. And with Nomad, which we're launching later this year, we hope to pull all that together to make it contextual, smart, AI integrated, and beyond. So join nomad.com. So in conclusion, it's a really interesting era in the reinvention of healthcare. It's no one technology. It's the layering of these technologies. As we pull these things together, I think we'll have our own web-enabled personal healthcare GPS. And so I encourage all of us to think about shifting healthcare from being episodic and reactive to much more continuous and proactive. And by doing that, we can realize that in many ways, like with my Google Glass, the future's already here, just not evenly distributed. And it's up to all of us, not just to predict the future of health and medicine, but to create it together. Thank you.